Hi guys, how are you today? I hope you all in good health. Uh, as far as we know, our country, our world is fight with dangerous virus. Yeah, we call it coronavirus or COVID-19. Much of people dead by this virus. It's so dangerous, guys. But don't worry. In these videos, I will tell you how to prevent coronavirus. Let's watch my videos.
Prevention tips. The top tips: wash your hands. Why? Virus can spread from person to person via respiratory droplets. When an infected person coughs or sneezes, close contact can be infected. In addition, the virus can end up on doorknobs, elevator buttons, and other surfaces. If you touch the surfaces and then touch your eyes, nose, and mouth, you can become infected. This is why it's important to wash rigorously. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Indonesians are friendly. We not only shake hands, we also hug. These are ways we can transmit the virus. Cleaning. Hard surface disinfectants that are likely to be effective for use against coronavirus or COVID-19. Although they do not claim to kill viruses such as COVID-19, cleaners can play a role in helping limit the transfer of microorganisms. Using either regular household cleaners or dilute bleach, 1 part bleach to 9 parts water. The following high-touch surfaces, such as toys, toilets, phones, electronics, door handles, bedside tables, television remotes, etc. Wearing mask. If you are a healthy individual, the use of a mask is not recommended for preventing the spread of COVID-19. Wearing a mask when you are not ill may give a false sense of security. There is a potential rise of infection with improper mask use and disposal. They also need to be changed frequently. However, your healthcare provider may recommend you wear a mask if you are experiencing symptoms of COVID-19 while you are seeking or waiting for care. In this instance, masks are an appropriate part of infection prevention and control measures. The mask acts as a barrier and helps stop the tiny droplets from spreading you when you cough or sneeze. Overall, there's not conclusive evidence that wearing a face mask can help prevent being infected by the virus, and public health officials give mixed messages about usefulness for the general public. As we have reported, masks may not fit the face correctly, so you are still able to breathe in infected droplets. An expert worries that masks can give a false sense of security. Healthcare providers are trying to use masks properly, and there's evidence that they are effective in clinical settings. For people at home, using masks in certain situations, for instance, if you are caring for an infected person at home, the proper use of mask can protect the caregiver. Be smart about travel. The CDC advises that older adults and those with current medical condition should consider postponing international travel. Travelers should avoid contact with sick people and clean their hands often by washing with soap and water for at least 20 seconds or using an alcohol-based hand sanitizer with 60% until 95% alcohol. If you've planned a cruise or overseas travel, consider the possibility of travel disruptions in the event of an outbreak. Think about the consequence of being caught on ship or over a border when decisions are being made. That could limit or disrupt your travel without much warning. If you were quarantined, what would your backup plan be for your work and family responsibilities back home? This is something to consider. This is the most important. Don't panic. Start to prepare. This is not the time to panic, but this is time to prepare. Good old-fashioned preparedness planning for your family. Think about the threat of a possible outbreak in your community the way you think about a big snowstorm or a hurricane. If it never hits, great, but if it does, you'll be glad you prepared. Don't hurt, but stock your cupboards with some extra food and cleaning supplies. Each time you grocery shop, but a few extra items. Self-stable foods such as beans and rice are good option. Also, utilize your freezer to preserve food. Everything from meat and vegetables to cook grains and bread. Think about having enough on hand to last a few weeks. Keep your food. There is currently no evidence to suggest that food is a likely source or route of transmission of the virus, and there are currently no reported cases of COVID-19 transmission through food. People are unlikely to be infected with the virus through food. Scientists and food safety authorities across the world are closely monitoring the spread of COVID-19. If we become aware of a potential food safety risk, appropriate action will be taken to ensure the safety of Indonesian food supply. Coronavirus are killed by common cleaning and disinfection methods and by cooking food to save internal temperatures. Learn more about food safety. This is a simple tips. Here are 5 more things to remember. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue. Then, throw the tissue into trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe.
And then I hope we are strong in the face of this pandemic. Keep safety, keep healthy, keep clean, and don't forget to pray to God. Trust, be strong. Thank you for watching my videos and goodbye.